Have you ever thought about how drugs travel and are transformed within the body? The process is quite interesting, and it's known as pharmacokinetics. We'll explore its four main stages: absorption, distribution, metabolism, and excretion, and discover how understanding a drug's pharmacokinetics allows us to tailor treatments for individuals. Join me as I unravel this complex journey that medications take within our bodies. At its core, pharmacokinetics is the study of a drug's life cycle within our bodies, encompassing four main stages: absorption, distribution, metabolism, and excretion. The term pharmacokinetics is derived from two Greek words, pharmakon, meaning drug, and kinetikos, meaning movement. Essentially, it provides us a clear picture of how the body handles a drug through absorption, distribution, metabolism, and excretion. The first step in the process is absorption. This is how the drug enters your bloodstream. Despite the fact that there are many dosing formulations available, such as tablet, capsule, liquid, cream, or injection, to name a few, all of these pharmaceutical formulations may be divided into just three fundamental dosing categories: enteral, meaning via the GI tract; parenteral, which technically means any dosing other than the GI tract, but most clinicians consider parenteral any dosing form that's given by injection, either IV, IM, or subcutaneously. And lastly, there is a topical administration. These methods are the drug's routes of administration. Certain routes, like intravenous therapy or intramuscular injection, give the drug a direct pass into the bloodstream, and they're said to be 100% bioavailable. But when the drug is taken orally, it must first pass through our digestive system, where a number of factors, including the medication's form, such as tablet, liquid, or capsule, your most recent meal, and your body's pH level, might affect how well it's absorbed from the gut. Also, before a medicine that is absorbed by the intestines can be circulated throughout the body, it must first travel via the venous portal system through the liver. If a significant percentage of the drug is chemically altered into inactive metabolites in the liver, then a much smaller amount of the drug will pass into the systemic circulation. In other words, it will be less bioavailable. Such a drug is said to have a first-pass effect, and the bioavailability of the drug is less than 100%. Topical administration of a drug is less than 100% bioavailable because of the many obstacles it must overcome before absorption via the capillaries. After the drug's absorbed, it must be distributed into the various areas of the body. But not all areas of the body are easily accessible. Organs with an extensive blood supply, like the heart, liver, kidneys, and brain, are easier to reach than muscles, skin, and fat. Many drugs are also bound to proteins in circulation, and it's only drugs unbound to plasma proteins that can effectively reach their target extravascular tissue. It's like a drug needing a special pass to enter certain areas. The majority of protein-bound medication molecules are carried by albumin, which is the most prevalent blood protein. If a drug binds to albumin, then there's only a finite amount of a given medicine that is unbound. It's important to understand that bound medication is pharmacologically inactive, and unbound medication is pharmacologically active and is often referred to as free drug. This is an extremely important concept to understand because there is a higher percentage of free or unbound active medication in circumstances that lower albumin levels, like severe burns and malnutrition. An unexpectedly high amount of free drug could increase the chances of medication toxicity. Another important factor is that when a person is taking two highly protein-bound drugs, the drugs may fight for binding sites on the albumin molecule. Because of this competition, there may be more unbound or free drug available. After absorption and distribution, the next pharmacokinetic stage is metabolism. It involves converting a drug into an inactive metabolite, a more soluble substance, a more potent active metabolite, or a less active metabolite. The liver is the organ most in charge of drug metabolism. Skeletal muscles, kidneys, lungs, plasma, and intestinal mucosa are additional metabolic tissues, but to a much lesser extent. In its metabolism of drugs, the liver employs a large class of enzymes known as the cytochrome P450 enzymes. These enzymes transform the drug. If a drug is water-soluble or hydrophilic, it's an easy biotransformation and may not require the P450 enzymes. But if it's fat-soluble or lipophilic, then we need the P450 system's help. The liver's capacity to metabolize substances varies greatly from patient to patient. Genetics, illnesses, and concomitant use of other medications are some of the many variables that affect biotransformation. Lastly, we have excretion, the final phase. During the metabolism phase, the liver's numerous mechanisms are used to biotransform the majority of medications. And by the time most medications reach the kidney, there's little of the original drug remaining. Here, the drug, having fulfilled its purpose, is removed from the body, mainly through the kidneys and into the urine. The liver and bowel may also be involved in the excretion of medicines, but to a lesser extent. Drugs that have undergone hepatic metabolization become more water-soluble, and due to the water-based nature of the urinary system, this greatly facilitates the kidney's ability to eliminate them. There are some drugs that may get into the kidneys without experiencing the liver's metabolic process. Although often to a smaller extent than the liver, the kidneys themselves are capable of metabolizing a variety of medications. It's important to note that not all drugs follow this four-step journey. Some might bypass a stage, depending on their design and purpose, like intravenous drugs that skip absorption and head straight to the bloodstream. So why does understanding this matter in healthcare? Well, knowledge of pharmacokinetics helps predict how a drug will behave in different individuals, ensuring safe and effective treatment. For example, two patients may need different doses of the same drug due to variations in their serum protein levels, metabolism, or excretion rates. To give a real-world example, let's consider two patients. They're both 60 years old and suffer from the same condition, requiring the same medication. However, one patient has a history of liver disease, which might affect drug metabolism, and the other has reduced kidney function, which could impact drug excretion. Understanding these individual situations helps tailor their drug doses and schedules for optimal therapeutic effects. Well, there you have it, a quick journey through the world of pharmacokinetics. Thank you for joining me, and if you would like to check your knowledge of pharmacokinetics, there's a link to a short quiz in the description below.